Because I'm sure you have a lot of patients talking about sex and having all kinds of questions, what they call
Yeah,
personal questions. But what excites you about that topic?
girl, I've always been kind of freaky. I'm not
That's a
even
good
joking.
answer.
I'm being very serious. If you know me from since I was a kid, I've always been very interested and very curious and very outspoken, a little precocious when it comes to that. And so no one was surprised when I became an OBGYN.
Welcome to Journey to Joy Live, a podcast to promote wellness, resilience, and inspire joy. Be empowered to balance your mental, physical, financial, aspirational, and social health while providing mental health awareness and breaking down the stigma of mental illness in the Black community. I'm your host, Dr. If Joy, and I'm here to help you transform life's challenges into opportunities for joy. Let's begin the journey together. Hello, episode 106, Joy Between the Sheets, Sex as Self-Care. And I have a return of a special guest, Dr. Renee Allen. She's an OB-GYN physician. Welcome.
Hello. I'm so happy to be back on here.
Awesome. I'm so happy to have you because when you were last here, we were talking about menopause, perimenopause, hormone replacement therapy, and all the things. And when I started speaking about sex and self care, you're like, oh, whoa, whoa, that's my favorite topic. And I'm like, oh,
Remember, I was
yeah.
that's I remember I was like, "Girl, now you talking my
I
language."
know your energy came up. I said, we got to have a whole episode about this.
Mhm.
So,
Yes,
for those who may have missed that episode, if you want to talk about briefly what you do in your
sure.
business.
I am a board certified OBGYN physician, and I'm the practice owner and CEO of a 12-state, 100% virtual telemedicine practice. I am licensed in the state of, let me just make sure that I can list this all off,
Ooh,
Connecticut, Colorado,
ooh.
Florida, Georgia, Maryland, Minnesota, Ohio, Pennsylvania, Wisconsin, and Washington. I hope, and Texas.
Ooh, I can't even do that.
Yes, so it's 12 states. And it is a practice that it's a micro practice. I want to make it small, don't want to bring on any more clinicians. I want it just to be myself. It's a practice that's with myself and my husband, who
Okay.
helps me in the back end. And my patients are my babies. They are near and dear to me. They get as much time with me as they need per month. So they meet with me monthly. They have a lot of resources within the program, any program that they have. And my programs are primarily, they're focused on hormonal balance.
Yeah.
Um, Primarily, and I customize it. It's very personalized in its approach. It's not a one size fit all approach at all. And so we can get into how I personalize it, but the patients, they get a full understanding of what's going on in their body when they come in. We do a
Awesome.
detailed analysis of different tests that are self-selected. I specifically self-selected to get the insights that I need because my goal is to optimize them. There is a point A and for them to get to a point B. And so we optimize them through looking at where they are hormonally, metabolically, nutritionally, even sex hormone
Nice.
wise. And then we have discussions and I educate. A lot of my program is so that my patients understand and they're educated as to what the evidence is out there. And so during our consultations, especially the initial consult, which is scheduled for an hour, but typically it goes an hour and a half to 2.
Nice. Good
It's a
quality time.
It's quality time. It's as much time as my patients need with me so that they fully understand why I am prescribing what I'm prescribing. And it's a partnership. So I
Mhm.
will tell them what the literature says is the best way to get this hormone. And what I mean by that is, for example, estradiol.
Mhm.
A lot of debate out there that you should only use it transdermally through a or
Mm.
if you wanna use it through a cream. Most people
Yeah.
patch because that's what's FDA approved. However, a lot of people are sort of confusing the literature out there with the WHI study that looks at synthetic
Mm.
hormones and trying to apply that to hormones that are molecularly similar to the endogenous, meaning the hormones that we
Yeah,
within our body. So, an
right.
example, estradiol, we produce that. It's one of the 4 estrogens that we produce in our body. It's the one that's most clinically active, and that is not the same as the synthetic estrogen, which was in the
Mm,
HI study, which was what was studied,
different.
Premarin, which is a hormone that is based from the urine, of pregnant mares. It's the estrogen from that urine metabolite. So, I want them to understand, a lot of people think that you shouldn't be giving estradiol
Mhm.
orally, but that's incorrect.
Yes,
It's
you can.
giving Premarin because Premarin is the one that has the increased risk of blood clots, heart attack, stroke.
Oh,
Especially that risk goes up after 10 years of use, and you should not be giving women who are 63 and older Premarin at all because the studies show that they are at definitely increased risk, especially that first year of therapy. So I don't prescribe Premarin, nothing synthetic. Everything that I prescribe is the same sort of molecular structure that our body recognizes as our own.
well, that's awesome.
Premarin, our body recognizes it as foreign.
Yeah.
Premarin contains only about 15% in that of estradiol. The rest are foreign estrogens that are specific to horses. And as I said to you before,
Oh, yeah, I remember that.
we aren't horses, right? So
Mm-mm.
so my patients understand what the best, form of delivery of that, in molecularly similar hormone is, and the
Mhm.
studies do show that it's oral, estradiol as long as it's the right patient. So, what I mean by that is if a patient has a genetic, mutation that puts them at risk for DVTs, or they've had a history of blood clots or DVTs, and they're on, like, Eliquis or something,
Mhm.
history, then obviously I'm not gonna, because everything has risk to it. Even our
Yeah,
just hormones, like,
gotcha.
even the hormones we produce, if we produce too much of it, it can have
Yeah.
side effects. So in those type of patients, I am not going to give them extra hormones, that does have a slight risk, but it's not the
Mhm.
same as Premarin of increasing, blood clots, because estradiol in and of itself, if it's given in a larger, or if you produce it in a higher quantity, you can increase your risk on your own endogenously of that.
Ooh, I bet.
So I'm not gonna give it to that patient. It's all about patient selection. Who is the best patient to get the best form? But if you don't have those issues, medical issues, which makes me pause and say, "Okay, we're not gonna go the optimal route, which can optimize you the best, which is oral
Mhm.
estradiol." I'm sorry, everyone out there who feels that it's not, and my other OBGYN colleagues that feel that it's not. It is. The literature shows that it is. It can optimize you. It can reverse abnormal lipid profiles. It can do all of that stuff in the right patient. And
Okay.
so my patients come away knowing, and it's a partnership. If their lifestyle doesn't call for a certain delivery form of the hormone,
Uh-huh.
then we adjust it, according to, what's going to suit them, and personalize it as long as they understand what they may be giving up, by
Gotcha.
choosing that route. And so, yeah, so my practice is set that way, and I primarily focus on, we do weight loss management.
Yes.
My primary thing is, the hormone replacement, and that can branch off into many different forms. It can be perimenopausal management, it could be menopausal management, it could be PCOS management, it could be thyroid management, it could be postpartum depression management, because I do
Right.
have patients that, I have them on oral microdosed, progesterone at higher levels to,
Mm. Really? Okay.
and then even the injection form of the progesterone in oil to treat depression, okay?
Mhm.
It could be that, or it could be why we're here, sexual wellness.
All right. Well, then let's dig into that because I'm sure you have a lot of patients talking about sex and having all kinds of questions, what they call
Yeah.
personal questions. But what excites you about that topic?
Girl, I've always been kinda freaky. Well, that
That's a
is
good
true.
answer.
I'm being very serious. If you've known me from since I was a kid, always been very interested and very curious and very
Mhm.
spoken, a little precocious, when it comes to that. And so no one was surprised when I became an OBGYN. No, nobody in my family, my close circle. I love sex. Who doesn't love
Mhm.
sex, man? And if
Right,
you have
100%.
great sex, which we all should be having, then
Right.
yeah, I'm gonna try to help you to get that. Okay.
Yes.
Achievable. It's achievable. So yeah, it's a very I do have patients that come to me who it's so sad. Never had an orgasm ever.
Yeah. Oh, not
Never
even alone, huh?
not even alone.
Oh,
I think the last time we spoke, I
yeah.
quoted, and I misquoted,
You
it's actually a little
did.
bit less. It's 15% of women,
Okay.
have an orgasmia, meaning that they've never had an orgasm, and I can help
Ah.
them achieve it. There's a different sorts of medical therapies
Mhm.
that I do have to help, but I can also help if you have a decrease in your libido, so you don't have really a lot of desire, or, let's just say that you have a lot of vaginal dryness, which is
Mhm.
impacting your sexual, life. I can obviously, help you with that. But it's mainly women who are coming in who just don't desire it anymore. They have hypoactive sexual desire disorder, or they have not achieved orgasm, or they do achieve orgasm. They just want to, as I said
Making
before,
more.
make it better, baby.
Hey, yeah, let's do that because sex can be self-care and then add to your wellness, which is why we're talking. And really, where I got that from is that I noticed, a lot of women, overachievers or busy bosses or whoever you are, right? Sex gets put on the back burner. It's
And
kinda like, "I'm too tired for sex." There's relationships that they just haven't had sex for weeks or months. And they attribute it to being tired, and a lot of people say, "Well, it's more going on." It's not they're not just tired, it's other things going on, but still, I feel like the same way we prioritize work or our kids or other things, I'm always saying prioritize you, of course, prioritize your self-care. We should prioritize sex so that that's not getting neglected, and if you don't want it that much, then go to Dr. Allen so she can help you want it and make it
ramp
feel
it up.
good.
Yeah. I am all about my practice is all about, lifestyle medicine,
Mhm.
integrative medicine, where I'm using different, lifestyle transformation approaches, in order to get you the optimization. It's not just me giving you a prescription. You actually there's programs to help. Like, so for example, stress management is huge. It can actually override and impede the hormones that I'm giving you. And so
Mm.
it's a part of my monthly meeting with them to try to address to ensure that they understand and they learn techniques to decrease their cortisol levels, that they're sleeping well and they know what it takes to have proper sleep hygiene. So it's really based in that. And lifestyle medicine, it's not just about nutrition, activity,
Yeah.
stress management, and sleep. It's also about sex, or it
Mhm.
should be, at least in my practice it is. It
Yeah.
is something that we talk about. Sex is wonderful. It's not just for reproduction, as we all
Mm-mm.
know. It
Mhm.
actually helps us hormonally to be balanced, to helps us to,
Mm.
what is released, the oxytocin,
Yeah.
the adrenaline, if you see, I think that they've done MRI studies of the brain activity even after orgasming and what it can do, and even the neurotransmitters that are released and how it hormonally affects you and balances you. It is definitely something that if it's not a part of your life,
Yeah.
um, and you want it to be, or it should be, and you're having issues in that area,
Mhm.
something that should be addressed and not ignored.
Yeah, I mean, I imagine it can help with stress, anxiety, depression, the same way exercise does. Like, I'm
Absolutely.
always promoting exercise, 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 endorphins, and all those things. And like you said, I was going to ask that question.
Yes.
What are some benefits? I mean, if it's making us hormonally balanced, wow, why
The
not?
endorphins that are released, it lowers your cortisol levels, it makes you more relaxed. If it's vigorous, you're gonna, burn some calories too. I hope you are. I hope you're having it as much as you can and as often, and it's as enjoyable as it should be for you. Listen, life is stressful enough.
Mhm.
These are activities this is an activity that's pleasurable. Of course, it's for reproduction, but we're not going to be having sex only for reproduction. We should be empowered, whether you're a
Mhm.
woman or a man, you be empowered in your right to have a healthy lifestyle, and that includes a healthy sex life. It
Yeah,
really
and if you gotta schedule it in,
is.
schedule it in.
Yeah, and schedule it in. And so, it's interesting. I'm just hoping that as in the future, in the near future, there'll be more studies that are looking primarily, especially for women, to help them in the situation because we don't
Yeah.
actually have, not that I use only FDA approved medications, because honestly, I like
Mhm.
the personalized approach. And so I find with the FDA approved commercially available meds, it's more of a one size fit all approach. And I'm not able to really optimize my patients as much as I am when I am partnered with a very high quality compounding pharmacy that will give me the hormones that we endogenously produce. So
Mhm.
recognizing it as as same, but in different formats or delivery forms that will suit a woman's lifestyle. So,
Yeah.
for example, testosterone. It is been recognized that that in postmenopausal women, it is therapy that we can use to help
Mhm.
with hypoactive sexual desire
That
disorder.
makes sense.
But
That
we
makes sense.
don't have a commercially available FDA approved product for it.
Right.
So what a lot of physicians are doing
Uh-huh.
is that they are trying to kind of like doctor up the commercially available testosterone that we have, which are for men, you know,
Mm.
kind of apply it to women.
Oh, it
And
work the
that's
same.
yeah, the androgel. That's if you're
Mhm.
using the commercially available. Whereas on the other side of the coin, if you partner and understand who to partner with, what a proper compounding pharmacy looks like, what they have to go through in order to
Mhm.
maintain, their certifications to be able to dispense nationally. That's what you
Mhm.
want. To be legit script certified, that's what you want, and to be in business for decades, like mine has been in for almost 40 years, then you know that you can kind of feel confident that it's they open it up where you can go and tour their facilities to see exactly what they're doing. So I can now deliver these molecularly similar hormones in different forms. It doesn't just have to be a gel, and it's not that we are kind of doctoring it up and
Yeah.
because what they're saying is take a pea-sized form of the androgel and
Mhm.
apply it, and they're not even applying it the way where it should be. A lot of them are telling them to put it in their arm, on behind their leg,
Where do you apply it?
labia, and around the
Oh, right there in the area, and is this like an everyday thing, just before
every
sex? How long? Okay.
we don't want to risk transference, which you're transferring from one to another through sexual activity. So, what I tell my patients, they get testosterone cream from me. That's the most popular, but I can deliver it as a vaginal troche, meaning that it's a small, little, easily dissolvable pill that they stick inside and it just dissolves. If that is a better form for them, if they find that the cream is too messy, you see what I'm able to do through there,
Yeah.
and I'm not
Yeah.
able to do it through the commercially available, which is why I've opted this side. And so depending on how the woman, what her lifestyle is, I have different forms, but if it's a cream, it should
Mhm.
be at least 4 hours applied before you have sexual.
Got it.
Yeah, because you don't want to risk transference between you and your partner, and then his testosterone
Yeah.
levels go up,
Oh, okay.
especially if he's still in his reproductive years. So if you still want to have babies, you definitely don't want your husband to be
Ooh,
taking
that's key.
testosterone because it will lower his sperm count. The testosterone that you see men taking, it really should be for men who have finished their childbearing because it has all these benefits, and you're not caring about whether or not it's going to
Mhm.
his ability to get his partner pregnant. So 4 hours
Important.
at least, you
Mhm.
wait, if you apply, if you're doing the cream or the troche. And so because of that, every woman's different. I would prefer, that women take it at night and then they maybe use a panty liner at night, so that while
Save.
sleeping, it
Mhm.
allows, for it to work. But some women, they wanna have sex at night and they don't want to have to wait and time it and it's not spontaneous. So some women will opt to take it in the daytime, which if they do, there's more instructions because I don't want them to take it and then wipe it off when they urinate during the day.
Yeah. And so for this, you said it actually treats the hypoactive
It
sexual
does.
desire.
Yes, because you're
Interesting.
while you're applying it through the vagina,
Mhm.
the reason why is
Yeah, how does it work?
the the membranes that are there,
Uh-huh.
that is the best area for you to get, for you to have the alpha 5 reductase receptors.
Okay.
What kind of breaks down testosterone, into its components, okay?
Taking me
Estradiol,
back, I remember that.
DHT, its high concentration is there, is the labia. It's the because think about it this way: the skin, which is our largest organ form, is
Mhm.
a barrier. That is the whole purpose of the skin is really to protect us from the environment. It's not the best way to actually deliver hormones. It's not the best way to deliver a medication. It really isn't.
Gotcha, okay. So it's
Especially
really getting delivered to the through the bloodstream and somehow working. Is it getting to your brain or just only activating you down there to want
no,
be
it's
horny, basically?
chemically. So you, and the skin, if you're applying it here, patch, you're not gonna have a lot of those receptors here. You have those receptors down there where you are having like it's a membrane down there. It's a very thin area. It's not the same sort of tough dermis that's
Mhm.
down there in your inner labia. It's not.
Mm-mm,
Right?
mm-mm.
So it is like a membrane, so it's easily soaked up, and it also happens to be the area that has the most, the 5-alpha reductase receptors. So
Got
I
it.
get wonderful levels, and I follow my patients' testosterone levels, because I'm World Link medical trained. Okay, that's where I got trained, and I'm also Menopause Society trained.
Nice.
However, the Menopause Society only teaches about commercially available medications, and when I first started, I used those medications and I didn't get as much optimization, reversal of disease, prevention of illness as I do going this route now. So now I'm all this route. I know about the Menopause Society and I can debate my colleagues
Nice,
about it, but
nice.
I am more World Link trained, which shows you different optimal levels
Mhm.
for the different hormones. So I know what level I'm aiming for and what the evidence and research shows that once you're able to get that level, you're going to be able to build muscle easy. You're going to
Mhm.
be able to build bone as well too. You're
That
not
makes
able.
sense.
Mhm. You're gonna be able to get more energy, your libido is gonna increase, your concentration level is gonna increase, your focus through a certain level. So I'm able to follow them, and you would be amazed, how quickly those levels rise through application right where I told you it is. Yeah.
Now, does this actually work for most people? And if not, what do you do for people it doesn't work for?
So, it does, but so it's going to work. Your levels are gonna rise, okay? But what I would consider not work is that you can get some side effects for it. And
Mm.
usually in my practice, what I see is the side effects is, all right, so I don't overdose testosterone. So one of the things you should understand is the way that I'm delivering it, I can control how much they're getting per night. I can adjust it. I can tell them that they need to do because it's like a click, right? If they're doing the testosterone cream, I can tell them I can prescribe it as a quarter click or 1 click or whatever, and I'm getting on average, I start them out at 5 milligrams. That's what it works out to be per night that they're getting. However, I don't do pellets. Okay. I don't do pellets because number one, I'm a virtual practice, so I can't apply it to you. And I don't like pellets. I have a lot of patients who transition over to me from pellets. What I
Mm.
find is that the levels are very inconsistent that you get, and
Yeah.
tend to get when you first put the pellet in a huge rush of the hormone, which it's like an overdose with testosterone. So how you can get side effects that way, and what I see more common is when they have testosterone pellets, they're getting way too much testosterone and they start
Yeah.
to get hair loss. They start to get acne. They start to get they can even in really bad cases, they can get an enlargement of their clitoris as well too.
Ooh, yeah, that's
Really
true.
high levels, you don't wanna go there. I never approach those levels with how I'm prescribing the
Gotta be
testosterone.
careful.
What I can see sometimes, though, with how I'm prescribing it, and it's more having to do with them having insulin resistance.
Mm.
So if they have insulin resistance or like metabolic syndrome, which is kind of synonymous with PCOS, okay?
Yeah.
If they have that and it's not yet treated and controlled, or we're in the process of managing that, of getting them optimized with their insulin resistance, I can see sometimes with testosterone application that my patients may start to get a little acne breakout,
Oh, yeah. Or hair
or
growth, right?
get a little bit of hair loss. Okay,
Oh, loss.
so that
Like male pattern baldness?
it can't. Well, it's not going to get to that level, but they can start to see that
Yeah.
once, and I can predict, and I'll tell them, okay, you have a diagnosis, and PCOS does carry over into menopause, by the way. Okay, so I'll
Oh.
say to them, whatever their diagnosis is, if it's PCOS or if they are just insulin resistance, you are insulin resistant. We are managing it, so I'll manage it. GLP-1s are the main way that I like to manage it.
Mhm.
As long as they're adherent to ensure that they are getting the proper protein and fiber and building muscle while they're on the GLP-1s, because you can tend to have muscle loss
Mhm.
with GLP-1s, but they do because they see me every month and I counsel them. They know to do that. So GLP-1s are my favorite, but I can also prescribe metformin. So while we're
Of course.
optimizing them and correcting their insulin resistance, I can also give them a little bit of spironolactone to kind of help. Now, spironolactone blocks these receptors,
Mhm.
so you can say intuitively, okay, so you're giving testosterone and then you have this reaction, and then you're going to give spironolactone that kind of blocks it. Yes, it is. It's very specific to the like follicles of the face and hair. And I
Yeah.
give a little bit more testosterone if they need it in 3 months to kind of overcome the block. So that whole combination of giving the testosterone plus having them on the
Yeah.
spironolactone and optimizing their insulin is how I kind of, for those patients that start to have the acne or the hair loss, I minimize the acne and hair loss and reverse it. Okay.
Gotcha, and are they potentially on that regimen just indefinitely?
Well, if you are insulin resistant, it means that you metabolically don't are genetically inclined. Your
Mm.
body is just not metabolically optimized. So anyone who's insulin resistant needs to have something in order to get them metabolically optimized. It's kind of like it's a chronic condition, right? So they need to be.
Yeah, makes sense.
Oh, yeah, so they do need to be on it, but BHRT or, hormone replacement therapy, this is not, I mean, these aren't synthetic meds where you can only be on it for 10 years, then you need to come off because
Mm.
of
They're more natural.
heart attacks, strokes, cancer are going up, so you're off after 10 years, right? After 10 years of taking synthetic hormones,
Mhm.
then your body's gonna repel. No, these are medications that are similar to what you're producing. So you can be on these until the day that you die, okay? You're on
Wow.
it for life. So this regimen, is something that it's a chronic long-term management, just like thyroid hormone replacement if you have Graves' disease, or, if you, are diabetic and, you need to get optimized on it, it's gonna be a chronic management.
Yeah. Now, how often do you see women who come to you, maybe there's some trauma that's really getting into their not
Yeah,
wanting to have sex, not being able to have sex, or
often.
obviously vaginosis or pain with intercourse, things like that. How often do you see all that?
Yeah. I do see that, it's not common, but I do see it, and I
Okay.
have resources in place to help.
Okay.
For example, the vaginitis. Do you know what is the best form or what is the best way to kind of what I have seen
Mhm.
and what WorldLink teaches to
No.
resolve that? We have a syndrome called GSM,
Uh-huh.
genital urinary syndrome, that women can, who are postmenopausal because of the withdrawal of estradiol, they just have paper thin membranes down there,
Yeah.
and so they
Oof.
have chronic UTIs, they have burning,
Mm.
irritation, they have vaginal dryness. Most people will, and this is what the Menopause Society teaches, that they'll put estrogen cream, okay? And that's
Okay.
fine, but you can kill 2 birds with 1 stone by putting testosterone down there.
Oh.
I treat that with testosterone, and I can give them a little bit of, estrogen in that. I can mix it. I can have the compounding pharmacy for,
Mhm.
mix it, to help, but the testosterone
Yeah.
can also do the job of what the estradiol cream would do. It can help with the vaginal dryness. It can plump up that area.
Didn't realize that because aren't they kind of like doing the opposite?
No, because testosterone breaks down into estradiol. Remember?
Ah, right. Okay.
Remember the
Oh,
science, right?
exactly.
So
Oh, many
it can
years
do
ago.
that, and then and then we're killing 2 birds with 1 stone because then now
Nice.
you're also getting all the benefits of testosterone. So, yeah, so the different so here are the most common therapy sexual wellness therapies that I use. Testosterone cream, or
Mhm.
for some women who just feel that it's too messy, I can go to a troche, which is a vaginal tablet. It dissolves very quickly. Or I can do injections, okay? Because I can get it compounded and I know how to dose it up so that they can get injections. Injections isn't my ideal form, but we can do
Mhm.
that, okay? My ideal form obviously is the way that I said, applying it to the labia, because you get all of the other metabolic effects that way, much more easily. It
Mhm.
does help you systemically. I also prescribe medications like oxytocin.
So you do? I wondered about that.
I do.
Ah,
You can take it, like an hour or so, half an hour or so before your sexual
okay.
encounter. It kind of just so oxytocin is a hormone that, we as OBGYNs, I actually administer oxytocin to help induce labor.
Correct.
Because
Right. Like it's called Pitocin in that case, right? Yeah.
But when you orgasm, that's
Mhm.
exactly what's being released when you have the contractions of your uterus, because your uterus
Ah,
orgasm, okay? But also
one feels good, one feels horrible.
exactly. But also, oxytocin is also released when you breastfeed your baby.
Mhm.
It helps with the bonding.
So, yep.
So the whole theory is that when you take the oxytocin for sexual wellness, you are helping with that bonding with you, and that desire, that bonding. It's kind of changing your emotions and how you're feeling, your desire to have sex with your
Yeah. Now, are
partner.
there any side effects to taking that long term?
You can get, if you take it too much, you can end up getting, and this is theoretical, you can get a syndrome where you are expelling too much water. Um,
Oh. Like
yeah,
urinating
right.
or just
Like
dehydration?
yeah, it is I've never seen it, but that is the theory. If you give too much, you don't want to, but you're giving like a small dose, like about the amount that if you were breastfeeding a baby, that your body would release to form that bond. Okay. So you're not getting it to the levels that's going to cause that side effect.
Mhm.
Um, so that's a common one. The other one that's common to help with more of the bonding, the desire, the libido is PT-141.
Okay.
Okay, and the more generic term for that is called bremelanotide, and we call it PT-141. You can get it in either an injection, nasal spray form, or even sublingual, although the oral form is not as effective as when you inject it or spray it nasally. And it is, it's been approved for women, premenopausal women with hypoactive sexual desire disorder.
Mhm.
It's actually called Vyleesi, right?
Mm.
Vyleesi.
Okay.
And it's an injection, and it can be used off-label for both men and postmenopausal women, because it's
Gotcha.
been approved for premenopause, but you can use it postmenopausal and get beautiful results. And basically, the mechanism of action for that is that it's like melanocortin. It's a receptor agonist. It's a receptor with essentially that enhances sexual desire and arousal by acting on the central nervous system. Yeah,
Gotcha.
and it increases your sexual desire quite a bit. It increases your arousal. It even increases your satisfaction after the act. And it can be used on
Mm.
demand before sexual activity. Yeah. And
Oh,
so
that's great.
I prescribe that quite a bit. The other ones that I prescribe is I can give generic forms of like Cialis or Viagra as well. And then,
Gotcha.
of course, you know that that's approved for erectile dysfunction in men, but you can use it off label
For
in women
women.
for arousal disorder. Yeah.
Okay.
Well, the ones that are the medications that are the most commonly prescribed in this space for my practice is the creams, the arousal.
Mhm, mhm. And those definitely seem safe. That's good. These are all really great things. I really hope listeners are like, "Whoa, this is great," because there are a lot of women over 50 or menopausal women, they're just like, "I'm done with sex. It hurts down there. I'm dry down there. I don't even wanna try to date because these men, whether their age or younger, they want sex." And the men are even frustrated too, like, with the women who don't even wanna have sex no
Yes,
more,
that doesn't
so
mean
these
your
are
life.
their ways.
It does not have to be your journey. Listen, this is I am so glad that the narrative is changing for
Mhm,
menopause care. We are
mhm.
speaking about it much more. Like, when I trained 20 something years ago at Emory, the WHI had just come out and everyone was so afraid of those results. And people who
Yeah.
were, physicians who were prescribing hormone therapy for years for women stopped. There's a whole generation of women who really we did a disservice. And right
Mm,
now they are bearing with the negative repercussions of what happened 20 something years ago, meaning that
wow.
they're sicker, they have more heart disease, they have more osteoporosis, they have to have more hip replacements, they have more dementia. All of
Mm-mm.
these things can be prevented with proper hormone therapy. They really
The
can be.
right
But
hormone
because
therapy,
of what happened
exactly.
with the WHI, and then we moved away from hormones and we instead gaslit women, in my opinion, and gave
Mm.
them antidepressants and told them
Mm. You're
instead of
just
just
sad, here you go.
yeah,
That's like a Band-Aid, that's not treating the actual issue.
exactly. So we need to this narrative, I'm just so happy that we're changing the narrative. We're starting to talk about these things because we as women, and this is a new evolution in human evolution, in that we are living 30 to 40 years past menopause. If you look back, we actually died off at menopause.
Mm-mm.
Okay.
Mm-mm.
Now
Correct,
right.
exactly.
So we are living until we're 70, 80, and now we are now having to live till we're 70 and 80, all those years without hormones. What are the effects? Well, we're seeing that more disease. So now that we're talking about it and we're now back in the space and we have better hormones that are molecularly similar and not synthetic,
Mhm.
then you should be using them. Get on them. It's going to improve your health,
Do it.
but it also help your sexual life as well too.
Yes,
Just
which
as
helps your mental health too. See, it's all tied together.
all tied
Have
together.
sex, healthy sex, of course.
Healthy sets, just make sure it's someone who knows what they're doing, and it's not someone who's gonna be using
Exactly.
outdated knowledge,
Right.
okay, and telling you all kinds of crap about hormones and all this stuff. They're talking about the synthetic, they don't know the difference, and once they start saying that to you, you can tell that they don't know the difference. Go and get a menopause hormone specialist, someone who understands and who can help
Dr.
you.
Allen.
If it's not me, then someone else. You know what? I am gonna
12
promote
states.
and if you're outside of my 12 states, still contact me because I'm gonna promote my organization that trained me and trained me well is WorldLink Medical, and they have a provider directory. So if I can't help you personally, I can sure put you in contact with someone who can.
Oh, that's fabulous. Oh
Yeah.
my goodness. I'm just sitting back listening because I'm learning a whole lot, and I could tell that I'm getting old because, like, my friends, that's all they're talking about is perimenopause. I'm like, "Oh gosh, really? Are we there?" But last episode, you told me that I'm basically almost there.
Yeah, I'm there. I'm getting optimized myself. I'm on the journey with my own physician getting me optimized because the brain fog is real.
Yeah. Oh,
It's real,
yeah.
girl. You lose your train of thought so easily. It affects your life.
Oh my gosh, that's so true. Yeah, I'm double dosing on my fish oil, so that's what I do for now, but
Yes.
I'll
Yeah.
be calling you too soon, Dr. Allen.
It will be an honor to be your doctor. Just like
Oh,
any other of my patients, it's truly an honor
let's
for me to
hope.
treat them. Yeah.
Awesome. Well, thank you so much. Your website, clarify, is this the whole website or is
No,
this 2 websites?
no, it's actually just www.reneeallenmd.com. So you can just take off the whole Eterna part, and it's www Renee, Renee, Allen, Allen, MD, like medical doctor.com. Okay?
Gotcha. I thought something was wrong with that. I said it must have been 2
Yeah, no,
things
not
mixed
doctor, no,
together.
it's just www. That's it.
I'm like, this is the weirdest website ever.
Yeah.
Okay, I really appreciate you for coming back to Journey to Joy Live. Thank you
Always
so
a
much, Dr.
pleasure.
Allen.
Thank you, Dr. Joy.
This has been an Enjoy Life production. If you're in a crisis, don't hesitate. Call, text, or chat 988 for immediate support. Please note, this podcast is for informational purposes only and is not a substitute for professional treatment. If you're looking for therapy or medication management through Enjoy Life, visit www.drenjoylife.com to request a consultation. I'm licensed in 12 states. I accept Aetna in Georgia, Florida, and Virginia. Be sure to grab your copy of the Enjoy Note to help you on your wellness journey. Also, check out Inspired Joy for the wife, mom, boss to help you balance it all without losing yourself. Better yet, get the full Joy bundle for just $45. Remember, Journey to Joy Live is every Thursday at 7 p.m. Thank you for joining me, and until next time, may you continue to transform stress into joy.